On November 11th and 12th, 2009, pediatric nursing experts from a variety of settings and backgrounds joined together to address issues impacting the profession and the quality of care provided to children, adolescents, and their families. At this historic meeting, 5 issues were identified as critical to the continued growth and support of quality health care to children and young adults. For each of these themes, innovative strategies have been proposed to strengthen pediatric nursing care to children throughout the country.
Our success measure was that there would be a pediatric nurse wherever children are.
The third theme was around advocacy and the need for pediatric nurses to be engaged with other advocacy groups, as well as to create synergies between themselves and the families to promote pediatric nursing's contributions to their health.
There would be key pediatric nurses in each state that would be the point person for parents who wanted to advocate for whatever issue that they were interested in. Our top one we had was inclusion of child health, antecedents and consequences in national and federally funded projects, because this feels like it includes funding. And if you can make those changes at that level, then it would reach down to the children. We wanted to make sure that children's voices were heard as well as the parents. Our third success measure was development of a network of pediatric nurses that can bring together the science and information and advocacy tools for family-centered care. So really looking at that grassroots advocacy so that we can help parents advocate more effectively for their children's needs, for their needs for family-centered care. So we thought what would be helpful was to create a network of pediatric nurses who could support parents in their advocacy efforts. So whether it's at the local level where a parent wants to advocate for better school lunches, or at a state level where they want to look at policies that affect children, or a federal level, that there would be a pediatric nurse that could help them with a science background, with research background, so that when the parents go forward, or even a guide of how does one advocate. There are a lot of advocacy groups for special diseases. We all know about the Tay-Sachs group or whatever group it is. But there doesn't seem to be a strong advocacy group for parents who want to do advocacy issues on things that affect healthy children in the same way. And so we felt pediatric nurses could be a good resource in that way.